this year, 2 days ago, not too far, 2 more new cases were confirmed as COVID-19. They reported in 2 regions, one each from Ashanti region and the other Greater Accra region here. The first is a 56-year-old man, a Ghanaian, who returned from a trip in the United Kingdom on the 4th of March. He stayed in UK for 10 days and came back. He developed symptoms on the 12th of March, reported to a hospital in Obuasi, and the case definition met the case that of suspected COVID. Samples were taken. The sample from this case was sent to Kumasi Collaborative Center for KCCR for research. And within a short time, the lab reported back to us that they have finished the assessment of the report, and this is another confirmed case of COVID within the country. The second is a woman, a female, and a student, Ghanaian student. She traveled out to the United States of America, stayed for, I think, 10 days or so. She came back on the 9th of March, and then on the 13th of March, she started having symptoms that later were evaluated to be compatible with a suspected case of COVID. Samples were taken, sent to Noguchi Memorial Institute Medical Research. Samples were taken on the 13th. The same day, we had a report from Noguchi that confirmed this as another confirmed case of COVID-19. Both are currently receiving treatment under isolation conditions, and both are stable. I'm talking about the 2 of them that were seen on the 13th. Yesterday, late in the afternoon, we received a report of 2 new confirmed cases from Noguchi Memorial Institute Medical Research. The first is the 42-year-old Ghanaian male who returned to Ghana on the 8th of March. He had traveled to Switzerland and UK in the past 14 days. Symptoms started on the 9th March, and he reported to the health facility on the 14th March. Samples were taken, sent to the lab again, Noguchi Memorial Institute Medical Research. Within a short while, we had the report, and this was confirmed positive. The second case was a 41-year-old Ghanaian male. He reported to Tema General Hospital on the 14th of March with a history of fever and acute respiratory illness. This symptom started on the 10th of March. This case had traveled to Germany and Turkey within the last 14 days. Samples were taken, sent to the lab, again, Noguchi Memorial Institute Medical Research, and the report came back as positive for COVID-2019. Both cases had no symptoms on arrival, but presented with symptoms of fever and acute respiratory illnesses, and they were not having signs and symptoms at the time they were crossing our borders. Both are currently under treatment in stable conditions. Contact tracing has started. This brings to a total of 6 confirmed COVID-19 cases in Ghana, with no death. And this is the situation as at the close of 14th March 2019. That was yesterday. All the cases are stable. All the 6 cases were imported into the country. Distinguished ladies and gentlemen, permit me to use this opportunity to remind all Ghanaians and people living in Ghana to adhere to the preventive and precautionary measures, Key among those are as follows. Wash your hands regularly and thoroughly with soap and under running water, and use alcohol rubs sanitizers frequently. Avoid shaking hands. Cover the mouth and nose with tissue when coughing or sneezing, and dispose of the tissue immediately into trash bin. Keep a distance of at least 2 meters away from a person with fever, cough, sneezing, and difficulty in breathing. It is advisable to be physically active. Everybody is required as advised to drink plenty of water